Hi, everyone. Welcome to the next episode of the Kids Cancer Therapy Toolbox podcast. Our guest today is Cynthia, who interned at cc-TDI in 2019. Do you want to start off by introducing yourself?
Sure. My name is Cynthia Martucci. I'm currently a third year medical student. I went to undergrad at Emory in Atlanta, spent a couple of years at Dana-Farber doing some cancer research in my gap years before ultimately moving to New York for medical school. And that's where I've been for the past now 3 years.
Very fun. I just want to say before I get into the actual questions, I saw your dog on your TikTok, and it's like the cutest dog I've ever seen.
Yeah, so it's funny that you mentioned that. I actually work with the Guide Dog Foundation, which basically works to raise service dogs for visually impaired or other needs for veterans and things like that. And I actually went through the program initially in college and I raised a puppy to become a service dog. And their headquarters are actually based in New York. So I decided to do the process again since I've been in school. So it's a super fun way to volunteer, keeps my hands busy, but they're very cute and definitely like worth the process.
Yeah, that's so fun. So, my first question is, how does your life now compare to what you thought it would be like when you started college, and what have you learned about yourself?
Yeah, so I think in a lot of ways, my life so far has panned out how I envisioned. I really always saw myself going to medical school even before I started college. It was always the one thing that stayed constant. So I started college as a pre-med, stuck out through that. I took 2 years off between undergrad and medical school just to do some additional research, which originally like wasn't my plan. But I think that it worked out really well for me, and I learned a lot in that process. So I think overall, what I wanted to pursue actually happened. I got into medical school and I've, stuck it out since. So that part has been really reassuring. And I've always been interested in oncology. That path has changed a little bit in terms of now I'm thinking of pursuing radiation oncology, whereas before I was thinking doing medical or pediatric oncology. But still same vein, same kind of patient population that I want to work with in the future. So it's kind of all stayed the same, which is nice to know that I've always continued my interests.
That's so cool. And this is probably giving you flashbacks to like applying to medical school, but what made you interested in becoming a doctor?
Yeah, so a couple of different things, actually, cc-TDI being one of them. So, a family member of mine was diagnosed with hepatoblastoma, which is a rare form of pediatric liver cancer. And, I followed that process very closely, and it was really the first time that I was exposed to the medical field, from a personal standpoint. And ultimately, her tumor samples were sent to cc-TDI. This was in my, I think, junior year of high school. And so at that point, I had learned about cc-TDI and I had lived in New Jersey at the time. So I was very far away from the lab. But I actually applied for a summer internship the summer after my first year of college. So I spent the summer out there and I loved it. It was my first time hands-on into research in a field that I'd been interested in, but also now had like a very deeply personal connection to. So that really opened my eyes. And then ever since then, I've been interested in doing research for a very long time. It was specifically pediatric oncology focused. I spent a summer at the Jackson Laboratory doing pediatric oncology research. I spent, again, 2 years at Dana-Farber doing the same. So I think it really just kind of catapulted my life in a lot of ways. Again, because I'd always been interested in medicine, but that initial exposure really opened my eyes to like cancer care. And it's, been what I've been wanting to do ever since then. So it was really like a catapult that guided how my future kind of panned out to be.
Cool. So, talking about Emory, where you went for undergrad, why did you decide to major in neuroscience and behavioral biology?
Yeah, so for me, in undergrad, again, I was pre-med, so there were a lot of different options that I could have taken. But I'd always been interested in the brain, really. It's such a vast topic. And again, when I was at cc-TDI, my project was looking at a rare form of brain cancer in children. So for a long time, I really wanted to focus on neuro-oncology. So that's why I chose that path. But it was also very interdisciplinary. Like there was a lot of psych in there. It allowed me to go study abroad in Copenhagen for a semester, and also in Paris, actually, for the same major. So I got to have like a more like worldly perspective on the major, which was really fun. And I actually also minored in dance when I was at Emory. And so my like senior thesis project was kind of an intersection between how dance changes like the neuroplasticity of the population I was looking at was kids with Down syndrome. And so I developed like a whole dance program for kids with Down syndrome. And I did a study looking at like the neuroplastic benefits. So like how the brain actually changes and things like that. So kind of like two ends of the spectrum, but I found a way to integrate both science and the arts during my time at Emory. So that was really fulfilling for me to be able to kind of continue both of my interests at the same time.
Nice. So, talking about dance, do you still do that in your free time? And have you discovered any new hobbies?
So when I was in Boston during my 2 gap years, I was actually part of a like semi-professional dance company that I performed with. So that was really fun and fulfilling. Unfortunately, in med school itself, like I haven't had a ton of time for many extracurriculars. But sometimes, since I'm in New York, I go to the city and I take a dance class here and there. So I try to keep up with it when I can. But usually, whenever I do have free time in school, when I have like a weekend off or a couple days off, I really enjoy traveling. So that's how I maximize my time when I'm not studying.
Right. I don't know a whole lot about med school, but are you still taking classes over the summer?
So med school at this point is now year round. Last summer between my first and second year was my last summer basically. So between the second and third year, you study for a really big board exam. And so I took it a little bit early. So I had a couple weeks off in between. But that was kind of it. So I've been in my third year now for the past like 2.5 months.
So fun. So we already talked a little bit about this, but what research have you been involved in?
Yeah, so again, research has been like a huge part of my journey, which in some ways is not really what I expected, before I got into college. But I had gone through several different avenues for research. I was involved in research in undergrad, just in a lab for a couple of years. I had mentioned before that I was a Jackson Laboratory scholar for a summer. So I got to go to their campus and do an intensive, like 8-week program there. And then I had my 2 years of full-time working as a research technician at Dana-Farber. And that was probably my most influential exposure because, again, I was working a typical 9 to 5 every day for 2 years that culminated in several different publications, and I was really hands-on in the process. And then since being in med school, I've transitioned a little bit into doing more clinical research. And again, my interests now are in radiation oncology. So I work with several physicians at Sloan Kettering in the city, focusing on different aspects of how we can optimize radiation therapy, looking at different like genomic markers and seeing how we can maximize treatment and minimize toxicities in different populations.
Yeah. Do you have like a favorite part or aspect about research?
Um, Honestly, I think my favorite part is just like the people that I've worked with in the different teams. Research is very collaborative. And so I think especially, during my time at Dana-Farber, the lab was very big. And so you always like intermingled with different people's projects and everything was very collaborative. It was a very open space. And so I think that part made it really enjoyable. I think the research process itself, especially if you're doing basic science where you're in the lab, you're doing like cell culture experiments experiments, things like that. The process can be very tedious and, it takes a very long time to see your results. It's not like an instant gratification kind of thing. So I think day in and day out, really like the people in the lab are what make the experience.
Definitely. So, what has your experience in medical school been like, and how does it compare to undergrad?
It's very different than undergrad in the sense that you're a little bit more independent in terms of, especially for the first 2 years when it's just classroom learning. You go to your class for a couple hours a day, and then you have a lot of freedom in terms of how you want to spend your afternoons, whether that's studying, that's shadowing, that's volunteering, etc. But it's definitely more focused in terms of what you want to do. I think in undergrad, a lot of it is exploration of, doing a little bit of everything like liberal arts and sciences. But now in med school, it's what I've actually like always worked towards doing. So I think that's been really fulfilling to actually be able to go in, see patients, have people that I actually follow and they see me. So I think it's been kind of full circle now to have worked for this for so long, and now being able to step into those shoes that I've been aspiring to do. So that part's been really fulfilling.
Do you think the very long journey has kind of affected you or like changed you in any way?
Again, I think it's good that I've always wanted to go down this path. And I think you really need to have like a strong sense of motivation to get through it. If you're just in it for, the money or the prestige, there's a lot of other professions that I think would be an easier route to go through. But for me, like the most fulfilling part is just patient care and being able to like use my knowledge and my skills to help other people. And I think especially being in med school now has reinforced that. I think, the process of doing 4 years of undergrad, doing 2 years of a gap year, applying all that process, it's very delayed in terms of like actually seeing the results of that and actually becoming what you want to be. So I think now that I'm actually in my clinical rotations, I'm seeing patients every day. The journey has been worth it to this point. But I think it does take a long time to kind of stick it out, study for all your exams, get through all that pain just to get to this point. But now that I'm here, I'm really enjoying the process.
Yes. So, what advice would you give your younger self?
I would say I used to be like a really big stickler about everything being according to plan. Like when I started college, first semester, like I had a 4-year plan, and like, semester by semester, I would block out all my classes, everything that I had to do. And I didn't really like deviation from plans. But when I was in college, it was when COVID happened. And that was like a really kind of like altering thing for me, just in the sense of like, when things get completely uprooted, like how do I handle being able to move forward and be more flexible with my time and my perspective on things. So I think ever since that period of time, I've had a little bit better of an outlook in terms of just being flexible when things happen. Same thing with research too, right? Like things go wrong all the time. It's not just going to be like the first time you try something, you're going to get it right and it's going to be successful. So you really have to learn the process of just like accepting when things fail or things just take a lot longer than you anticipate, which I was not good at like a couple years ago. So I think I've definitely learned the skill of just like having patience and perseverance and just like being okay with things not going according to plan as you might like originally have had them.
Right. I remember I've been looking at my past 4-year plans for high school and they're just so different. I'm like, how did I ever think I was going to do this?
Right. And you have to have an open mind because certain opportunities just fall into place and you have to be okay with just, accepting it and see what happens because of it. Because, my thing is always just to take the opportunities when they come. You never know what'll happen because of it. But again, everything happens for a reason. So you might as well just be a little bit more flexible with your outlook on things to allow for those opportunities.
Yes. So my last question is what inspires you?
A lot of things inspire me. I think right now, again, it's so fresh because I've just started my clinical rotations a couple weeks ago. But I think actually seeing patients day in and day out really inspires me in terms of just like continuing on this path. Like we were talking about before, it's a very long road, and it's a lot of like delayed gratification in terms of actually seeing what you've been working so hard for so many years. So the fact that, I actually am the one stepping into the patient's room, I talk to them every day, and they're just like so appreciative of me being there, even if I'm not necessarily the one like giving them the final plan. I'm there to be an open ear to them and just listen to their concerns. And they're very appreciative of that, which, for me is like very gratifying, again, because I'm still like very early in my training. But the fact that people are so receptive of where I am now, in terms of, helping them on their journey, getting them to feeling better. I think that part has been really inspiring and, continued my motivation, now that I'm more than halfway through medical school, to finish this out and, really start my career.
Awesome. Thank you so much for taking the time to share what you've been up to.
Yeah, thanks so much for the opportunity to talk.